LaSalle University Ozamiz City. From the College of Nursing. This is submitted by Stephen Ian Biscatto, a nursing student. So what is pneumonia? Pneumonia is a form of acute respiratory infection that affects the lungs. The lungs are made up of small sacs called alveoli, which fill with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. The causes of pneumonia are bacteria such as Pneumoniae, virus such as influenza and rhinovirus, and fungi such as Pneumocystis jirovecii. The signs and symptoms of pneumonia can vary, but some common ones include cough, a persistent cough that may produce phlegm or mucus, which can be clear, yellow, green, or bloody. Chest pain, sharp or stabbing pain in the chest, particularly when breathing deeply or coughing. Shortness of breath, difficulty breathing or feeling breathless, especially during physical activity. Fever, a high body temperature, often accompanied by sweating and chills. Other symptoms include fatigue, feeling tired and weak, sometimes accompanied by loss of appetite and overall body discomfort. Rapid breathing, breathing faster than usual, accompanied by shallow breaths. Confusion. In older adults or people with weakened immune systems, pneumonia can cause confusion or mental changes. Bluish lips or nails. This is a sign of lower oxygen levels in the blood and should be taken seriously. The risk factors for pneumonia includes age of children, 2 years below, and older adults 65 years above. Environment, like crowded places or at home with infected family member. Occupation, which are works that might make you inhale toxic fumes or polluted air. Lifestyle habits, which include smoking cigarettes, drugs, and alcohol. Treatment and intervention. For a patient with pneumonia, there are several interventions that can be implemented to help manage the condition. Here are some recommendations. Medical treatment. Pneumonia is commonly treated with appropriate antibiotics targeting the specific bacteria causing the infection. Oxygen therapy. If the patient's oxygen levels are low, supplemental oxygen therapy may be implemented. Fever management. To alleviate discomfort and reduce fever, over-the-counter medications such as acetaminophen or ibuprofen can be used. Fluid hydration. Fluids to prevent dehydration and to thin mucus secretions, making it easier to clear their lungs. Respiratory therapy. This includes bronchodilator therapy, mucolytic therapy, bronchial hygiene, chest physiotherapy, oxygen therapy, intubation and mechanical ventilation. It is crucial to consult with a healthcare professional who can evaluate your specific situation, perform diagnostic tests, and provide an accurate prognosis based on your individual circumstances because pneumonia's severity and prognosis vary depending on several factors such as age, overall health, treatment, and a specific type of pneumonia. Some ways to prevent pneumonia is to 1. Get vaccinated. Make sure to keep up with your pneumonia vaccines. The pneumococcal vaccine is recommended for adults over the age of 65 or for those at higher risk, such as individuals with chronic illnesses, weakened immune systems, or smokers. 2. Avoid close contact with sick individuals. Stay away from people who have respiratory infections or illnesses, especially if they have pneumonia symptoms like coughing or sneezing. 3. Quit smoking. Smoking damages your lungs and weakens your immune system, making you more susceptible to respiratory infections, including pneumonia. 4. Maintain a healthy lifestyle. A healthy immune system can help prevent pneumonia. Adopting a nutritious diet and getting regular exercise. The pathophysiology of pneumonia involves an inflammatory response in the lung tissue due to the invasion and multiplication of pathogens. When the pathogens enter the respiratory tract, they can reach the lungs and infect the alveoli, which are the tiny air sacs responsible for oxygen exchange. This infection triggers an immune response in the body, leading to an inflammatory reaction. The inflammatory response results in increased blood flow to the affected area, causing redness and warmth. The blood vessels in the area become more permeable, allowing immune cells and fluid to move into the alveoli. This leads to the accumulation of inflammatory cells, such as neutrophils and macrophages, in the alveoli and surrounding tissues. That would be the end of the discussion. Thank you for watching.